Okay, so we have another call today. We like to answer questions about hospital beds and questions about what it is that you're looking for in a medical bed or a hospital bed when you're getting ready to purchase it. And one of the questions we get very often is, does the hospital bed have a chair position? And so today we're going to talk about hospital beds that have a chair position. What is a chair position? And different types of chair positions that beds have so that you can make the right decision based on what's best for you. Now, we've got several models here in the background here today at our showroom here in Richmond, Virginia, where we have all these hospital beds on display. And as Mr. Hospital Bed, aka Sean Callahan, Mr. Hospital Bed, we've been doing this for over 15 years. We sell hospital beds by the thousands, and we know these beds very well. So there's a couple different things about a chair position in a bed, and we're going to talk about how that's set up. And like I said earlier, the differences between those two different types of chair positions. But a chair position technically is a position where the person's elevated with the head above the foot and also with the head section up, maybe a bend in the knee. And chair position is very important because it speeds up recovery. It's good for circulation. And for people that are either temporarily recovering or people that are going to be using these beds for long-term care, a chair position is going to be very important to maintain and try to keep their health at optimal values. So that's really where the chair position comes in. Now, it's also very comfortable. So if you're in a chair, obviously being in bed, it's going to make it a lot easier to, do certain things throughout the course of the day, namely eating. And we have the over the bed tables and the side bed tables that you would use for that. But let's start off first about different types of chair positions that are in a hospital bed. Now, the beds directly behind me, and you can see these here. These are two beds that are made by a company called Hill-Rom. And it's actually the same bed frame, but just equipped with two different types of mattress. So we have the Hill-Rom P7500 Progressa bed right behind us, which is one of our top selling beds. And this is a hospital grade bed where you're actually physically putting your feet on the ground. Now, one thing that we hear a lot, and this is popular, not necessarily always good, but a lot of people will sleep in a chair or in a recliner because they find it more comfortable than actually sleeping in a hospital bed. And so, if you have a family member or you're a person that has that situation where it's actually easier, more comfortable to sleep in a recliner, that is actually not that uncommon. However, there are options for hospital beds where you can actually sit down just like you would in a chair, recline yourself back, and then find a comfortable position somewhere in that process that's actually good for you. And the ease of getting in and out of bed when you're actually sitting in a chair is obviously much easier. So with these two beds that we have behind us, which is the Hill-Rom P7500, now with the magenta sort of purple mattress, that's a air mattress system. And that air mattress system does a lot of other features, including turning the person. And then the one that's over here, this is the foam mattress version of the same bed. So it's the same bed frame, but it's actually equipped with two different versions of the mattress. And therefore, you can adjust and make sure that you've got the right surface to lay on. And as we've said in previous videos, the main difference is that air mattress systems are primarily made for people that spend the majority of time in bed or sitting down because they are at higher risk of getting a bed sore, pressure wound, or skin breakdown. And then foam beds are beds that you're still up and moving, but you're looking for little added features, a little additional comfort, and also, something that's going to be a little bit more professional grade to just make sure that you're getting the type of care that you need. But the air mattress system here, it's interesting because if you're looking at the one here with the pulmonary surface, excuse me, you can see that what happens is when the air mattress system is connected to the bed frame, the mattress adjusts to the shape of the bed. And so what's happened here is that we put the bed into a chair position. The bed knows it's in a chair position, so it immediately starts to deflate the areas that the person's actually sitting on because it would be unsafe to be on a air supported surface, and that would make it a little bit unstable. And so the bed does know that it is going into a chair, and therefore the air mattress system is always adjusting to the shape of the bed. And in addition to that, even though it is an air mattress system, it also does have foam. So there's air on the top, foam on the bottom. So when you're getting into these different types of positions, it's going to be easier to, transition off and on the bed. Now, you can also drop the side rail down on the bed. So if we came over here, I could drop the rail down. We could slide that person from the chair that they're in the bed, and we could slide them over into a transport, like a wheelchair or something. So there wouldn't really ever be a time where they'd have to physically stand up. However, if you're a caregiver, you can stand right in front of the person with your hands and help them up. And or they also make a piece of equipment called a sit to stand, where it's actually a bracket that you can hold on to, and it'll assist and help give you some lift to kind of get up onto your feet. So when you're looking at a bed with a chair position, these are a couple of the probably the higher end versions of beds that you can get. Now, Med-Mizer also makes a bed called an ActiveCare bed, and the ActiveCare bed would actually lift you up, turn you sideways, and put you in a chair position so that you could get in and off the side of the bed in a chair position. You could sit in a chair, but you wouldn't actually be sitting in a chair like you are with the Progressa, where the foot of the bed actually is going to go down 90 degrees and allow you to exit and enter and exit off the bed. And actually, right next to the in between here, this is actually a Progressa bed that's up in its high position, that's in the normal position that you might be at if you're laying flat, where you would use different types of air surfaces or whatever it might be to take a nap and what have you. Now, we also have the Striker Secure 3, and the Secure 3 bed is going to show you the other option that you're going to have using a chair position. And basically, what we'll do is we'll take the camera and bring it over, and then we can go through this. Now, this bed right here is in a chair position, but you can see that what you're going to do here is you're actually going to get in and out of the bed off the side of the bed. So the person's going to sit down on the side of the bed and then get in and out of the bed like they normally would. Now, with many of these beds, the side rails can come up and go down, and you can put these in if you need them or take them down. This one here opens up, in a way that you can drop it down so you can completely clear that whole section of the bed. And then in addition to that, I'm going to move this over. And you can see here that you have the chair position button right here that you can push. So you would literally just push this in. And I've already done it before we started the video, but you would simply put the chair into the position, and that would actually allow you to put it into the position that it's comfortable. Now, the other thing about the chair position is that you don't have to have it fully into a chair. So if there's a point in the chair position where you're really comfortable, you can stop the motion of the bed. Chair position is really nothing more than a feature called Trendelenburg. And Trendelenburg is a feature that puts the head above the feet. Normally in a hospital setting, you want to be at least 30 degrees above. The heart wants to be at least 30 degrees above the other part of the body. And that's there for cardiac related issues. And so Trendelenburg also can go the opposite way, where the feet are above the head. And many times that feature is used to help slide the person down, but primarily it would be used if somebody has swelling of the feet, lymphedema, and or gout, and it would help circulate and bring the circulation back into the main body. And so having the feet above the head, and you can determine the degree of angle that's good for you, but many times in a home setting, they're going to use that feature in order to help bring the person back up to the top of the bed in case they slide down. So when you're looking at a hospital bed, any bed that technically has a Trendelenburg feature will sit into a chair. And once again, a chair position is really good for bodily circulation. It's really good for recovery. So if it's in a hospital, long-term care, or recovery care type setting, a chair position with a circulation and with having the person upright is always going to be advantageous for overall wellness, overall health. And so these are a few of the models of beds that we have. These are really the two primary types of a chair position. One is a full chair with your feet on the ground that's almost like a reclining chair, if you will. And then the other one is a bed that, sits into a chair, but you're still going to get in and off the side of the bed. And with the Secure 3 and even with the Progressive beds that we've got here in this particular video, they can be equipped with foam, they can be equipped with air mattress systems, but we get a lot of questions about people looking for a hospital bed with a chair. And so a semi-electric bed is generally that's not going to be able to perform that feature. And many full electric beds really do not have Trendelenburg. If they're a home care medical bed, they might have power up and down, they might have power head and power foot, but they will not have that Trendelenburg feature. And so even if the bed didn't have a chair button, if it has the Trendelenburg feature, it will still allow the bed to sit into a chair position. In fact, we have in the background, there's a Striker Secure 2 that's kind of back over my shoulder over here. And even though they didn't put the actual chair button in that bed, I can put it in Trendelenburg position, raise the head, raise the foot, and in fact, now it is in a chair position. So these are some of the questions and answers that we've got with USA MedBed, with our company here with Mr. Hospital Bed. Our goal is to find the solution that's best for you. And so we have many beds that are hospital grade beds that'll do this. We have many home care type beds that can do this. But the goal is to make sure that the person on the bed gets the care that they need and is able to adjust the type of bed based on what the need or what the concern is for that particular person. And so in this video here today with Mr. Hospital Bed, we're talking about beds with a chair position, different versions of a chair position, what is a chair position, and how the Trendelenburg feature helps that, and what the difference is then in getting in and out of the bed, which we would call ingress, egress, which is the clinical name for that. So if you're looking for a medical bed, and you like the videos, we've been doing this over 15 years. We have locations in San Diego, California. You can reach us there at 858-263-4894. You can also reach us here in beautiful Richmond, Virginia at 804-495-0770. And we ship beds all over the United States. We ship and deliver all over, even actually all over the world. We ship a lot of beds overseas. But if you're looking for a medical bed or a full electric hospital bed with a chair position, give us a call. And don't forget to visit our website, number one, hospitalbeds.com, also hospitalbedshop.com. And you can go down in the description. We also have the new Mr. Hospital Bed site, which is just days away or even maybe a week away from being launched, where we're going to have a lot of great information, a lot of great questions and answers. So from Richmond, Virginia, this is Sean Callahan, aka Mr. Hospital Bed. Give us a call if you have any questions. Subscribe and share if you like the video, and we'll look forward to seeing you on the next one.